So, hi, Dr. Dabholkar. It's very nice to have you here, and thanks for joining me. So, I'll start with my first question, which is how does COVID-19 affect children, like those who are below 1 year, infants, newborns, and also toddlers, and above that?
Uh, See, Divya, overall children are less susceptible to infection by SARS-CoV virus as compared to other respiratory viruses. Non-SARS coronaviruses are common in children and often resulting in upper respiratory infections. Their frequent exposure to other coronaviruses is helping protect them severe COVID-19. And that is one hypothesis. This is because children have strong innate immune response due to trained immunity secondary to live vaccines as well as frequent viral infections. Now, in first wave of COVID, that is in 2020, last year, we observed that only about 3% of total COVID cases were children below 10 years of age and 12% below 20 years of age. Most of the children who are infected typically did not become as sick as adults. And in this second wave, number of people infected is much higher, and proportionately, of course, total number of children are also high. Uh, this is probably due to mutated or changed virus, and people also are very casual for precautions like social distancing, masking, and hand hygiene. Babies under 1 year old and children with certain underlying conditions may be more likely to have severe illnesses from COVID-19. This is likely due to their immature immune system and smaller airways. In the second wave of COVID, absolute number of newborns, even newborns, I'm telling you, with late onset disease has increased like in all other age groups. Newborns can become infected during childbirth or exposure to sick caregivers after delivery. There are very few newborns who get COVID-19 infection as such. Most of the infected neonates are asymptomatic or do have some symptoms related to prematurity and its complications. Incidence of infection is more in the second wave than last year. COVID-19 pneumonia is being seen more commonly in newborns, and other inflammatory syndromes are also have been noted in newborn. COVID-19 infection affects these children about 1 year and up to teen. By one, direct effects of infection causing acute respiratory infection, gastrointestinal infections, and very rarely neurologic infections. Multisystem inflammatory syndrome, MIS, is seen in children and adolescents temporarily related to COVID-19. And you may get atypical presentation too. And of course, this COVID-19 infection affects with indirect effects also. As you are aware, downscaling or closure of regular preventive health services, closure of schools, so learning and socialization is affected, mental health issues, and nutrition. So this is how all these kids, infants, and up to teens, they are affected.
Okay. So you mentioned about the underlying conditions, right? So what kind of underlying conditions or comorbidities in children can make them more susceptible?
Yeah, most of the children who get infected are asymptomatic, but those who have certain these underlying conditions like asthma or chronic lung diseases, then diabetes, genetic, metabolic, or neurological diseases that may be congenital, acquired, whatever I mean. But these kids are more prone to the COVID-19 infection. Sickle cell disease, congenital heart disease, that is defects in heart since birth, and certain immunosuppression, that is weakened immune system. This is due to medical condition or like leukemia, other cancers, or being on medication which suppresses immune system. Like in nephrotic syndrome, we give steroids, so thereby, or for malignancies, we give uh, anti-malignancy drugs, which also have immunosuppressive effects. So all these conditions also lead to increased susceptibility to coronavirus. And Of course, children with multiple chronic conditions that affect many parts of the body are dependent on technology or other significant support of daily life. They also are more prone to this infection. And of course, last but not the least is obesity. Obesity in children is also underlying condition which make them more prone to this kind of infection.
Mhm.
Current evidence on which underlying medical condition in children are associated with increased risk is limited. And children with these conditions, regardless of age, are at increased risk of serious disease, not only just infection, but serious disease compared to other children.
So you told a little bit about the differences between the second wave and the first wave.
Yeah.
So in particular, have you been noticing that the mortality rate is very high in the second wave compared to the first wave? Or is it just the infection rate?
Yes, the number of people infected in second wave is much higher. So
Yeah.
the spread is faster, and proportionately, the total number of children infected has also increased. So it seems to spread very rapidly. And see, what we see is whole family being affected in short time. So
Yeah.
far, there is no difference in mortality in the first and second wave in those 40 and under in India as per ICMR reports.
So, if the child actually ends up contracting coronavirus and if it's a severe illness, so what kind of complications have you seen in terms, when the child has severe coronavirus?
Yes, in case of severe illness due to coronavirus, a child may get severe pneumonia, acute respiratory distress syndrome, or secondary bacterial infection leading to sepsis or septic shock or multi-organ dysfunction syndrome. This multi-organ dysfunction syndrome, what we call as MISC, and this is temporally related to COVID-19 infection in children. Overall, it is uncommon and
Yeah.
incidence is less than 1% of all COVID-19 infection in children and adolescents, and less than 10% of hospitalized children with COVID-19 infection. This syndrome occurs due to immune dysregulation, antibody enhancement, and enhancement of inflammation.
Hmm.
Its exact pathophysiology is still incompletely understood. But this condition is diagnosed in children who had infection previously, but it is also seen among children, especially in this wave, those with active infection. Thus,
Okay.
MISC is a condition where different parts of the body can become inflamed during, including heart, lungs, kidney, brain, skin, eyes, gastrointestinal organs. So this condition can be serious, even deadly, but most children who were diagnosed with this condition have gotten better with proper medical care. So early diagnosis, prompt treatment is the key to success.
So, how common do you think this MISC is right now among
It's just,
children?
if you take total infection rate, it's very less, very less. But as I
Okay.
told you, among hospitalized patient, uh, hardly 10%.
Yeah.
As it is, hospitalization is less for
Yeah.
children.
Hmm.
Amongst them, only 10%. So it's very less as compared to the incidence of disease.
Okay. So, according to you, like, what are the red flags that parents should watch out, in with children with regards to coronavirus, and when should they see the doctor?
Yeah. We should, for this, we should understand the clinical phenotypes of COVID-19 infection in children. Child may be infections during this period. An asymptomatic child is one whose test for COVID-19 infection is positive, but the child does not have any sign or symptom, and his chest image is also normal. Classical manifestation of COVID-19 infection in children is fever, cough, cold, sore throat, shortness of breath. So they are simple like any other viral illness, and it is indistinguishable from other viral illnesses. But this symptom complex, in second wave, it has been noted that other symptoms, and now we are noticing this more, that they may present with pain in abdomen, vomiting, loose motions, and atypical presentation with just rash It may be maculopapular rash or urticarial rash or vesicular rash. So it is very different than what routinely we see common like other viral illnesses.
Mhm.
And reddish purple nodules are also noted on distant digits in children as well as some young adults. Uh, Red flag symptoms to be watched out in these children are first, increased difficulty in breathing. See, they will have respiratory symptoms like cough, cold, fever, but that is simple. But when they have increased respiratory excursion, they have difficulty in breathing, rapid respiratory rate, or chest indrawing, nasal flare, and bluish discoloration. These are red
Mhm.
flag signs.
Mhm.
Then the child may become lethargic. He's not drinking water or any fluid. Generally, what happens, these children, they appetite goes down, but they drink water. They take
Yeah.
fluid. But
Mhm.
when they don't even drink water, that is red flag sign. Persistent high fever for more than 5 days.
Mhm.
Generally, we take it as 4 to 5 days, but 5 days is taken as a limit. And nowadays, everyone is using pulse oximeter at home, even in
Yeah.
India. So,
Mhm.
oxygen saturation dropping below 95% at home ensure proper recording with good display on pulse oximeter. So, less than 95% also, it's a red flag sign for children. And of course, alter sensorium or convulsions.
Mhm.
So it is good to take teleconsultation for your child from your doctor rather than taking him to clinic when he just presents with fever, cough, cold. You need not go for that. But you should be aware of these red flag signs. And if you notice them, immediately you have to take baby to the hospital. So if any seriousness is perceived, the child should be taken to doctor. Their teleconsultation is not of any use.
So right now, how are the children being treated for COVID?
Absolutely right. In case of mild diseases, children may not have high fever. They may get influenza-like illness like cough, running nose, mild fever, not having respiratory difficulty, not hypoxic. And few children with mild disease may have only gastrointestinal symptoms like vomiting, loose motion. These children require home isolation. Remember, home isolation is important. They should not roam around in the house. Rest, supportive care, plenty of fluids, proper feeding, soft, light diet, and simple medicines like paracetamol, acetaminophen, that is 10 to 15 milligram per kilogram per dose, just to control fever. Uh, of course, maintenance of hygiene is of paramount importance. And one may give vitamin C or zinc, even vitamin D to boost immunity.
Mhm.
It is important to report if we already seen danger signs like rise of temperature, development of breathlessness, or lethargy is noted. But if the child has evidence of moderate disease, that means increased respiratory rate according to age, because at different age their respiratory rate is definite. So if you feel chest is indrawing, child is getting some difficulty in breathing, then you have to take him to doctor because he is going for moderate disease. Oxygen saturation falling below 94%, but above 90%. These children are not that serious but require hospitalization and management. But as you are aware, more than 60 to 70% of infected children are asymptomatic. An asymptomatic child is always treated at home like mild cases. His temperature is checked because generally asymptomatic child doesn't have temperature and he's playing about. Even parents are not aware of this infection, neither child. So his temperature is checked every 6 hours if you suspect, and if it is more than 100 degrees, then only give medicine to reduce it. It is advisable to give plenty of fluids, maintain its hydration, and the child is given nutritious food and looked after his general well-being. Keeping watch on her respiratory symptom, if possible, checking his or her oxygen saturation is advisable. Uh, but if I feel we'll see the different situation in family and how to manage them. If mother and child both are positive for
Yeah.
COVID-19,
Mhm.
then let the child be with mother unless mother is too sick or hospitalized. In case of infant, let him continue breastfeeding, even if mother is positive. And if mother is positive but child is negative, still, if mother is not very sick, she can take care of baby, but she has to follow certain guidelines like masking, then hand sanitization, and keeping baby away whenever she is not feeding. But she should continue feeding during that period also when baby is negative and child mother is positive. And if child is positive but parents are negative, see, this is third scenario. In that also, parents can take care of the child in and out of hospital. However, in such scenarios, the parent should use proper mask, and here PPE kits we
Yeah.
are advised because they are negative, so they should not contract disease, neither should they carry home that disease. So avoid leaving children with COVID suspect status with grandparents. This is again an important instruction to the parents or all people. Elderly people are at very high risk of serious disease, and unless child status is definitely corona negative, child should not be left with grandparents. So this is to be remembered.
So you mentioned about the diets and supplements, right? So what kind of diet or supplements can we give to children to boost their immunity?
Yeah, this is, this is in particular, it is always advisable to encourage balanced food and not supplements to boost immunity. So this everyone should remember. Don't get some ready-made supplements for it. Well-balanced diet, homemade well-balanced diet, which includes proper amount of fresh fruits, green leafy veggies, salads along with proteins, carbs, fats are very good, give you good immunity. In era of COVID-19 pandemic, zinc supplements, vitamin C, vitamin D, as already I have mentioned, are given to patient to boost immunity. But in children, it is always recommended to give protein-rich food
Mhm.
in form of dairy products or meat or legume, like chicken soup you can give,
Yeah,
legumes, sprouts. It is always advisable to give complex carbohydrates instead of refined carbs or
yeah,
sugar, and try to limit intake of fried snacks, junk food, thereby decreasing intake of unwanted fat. Regular consumption of fruits and vegetables rich in beta carotene, hmm, like carrot and all those, and ascorbic acid help boost immunity. So I will mention few things like mushroom, tomatoes, bell peppers, green leafy vegetables, some natural immunity supplements like ginger, gooseberries means avla, amla, what we call, turmeric, haldi, garlic, basil leaves, tulsi, black cumin, and certain seeds like sunflower seeds, flax seeds, pumpkin seeds. All these are proved to be very good immune boosters. So they are now natural sources. We have to remember these. Then yogurt and fermented food are also excellent sources to rejuvenate the composition of gut bacteria. See, now in second wave, we are noticing gastrointestinal symptoms. So if you give this, these are definitely going to help baby. So which are very, very important for nutrient absorption by the body. So I
mhm.
feel this is a major
Important.
thing we have done, very important thing
Mhm,
we should,
mhm.
everyone should be aware of.
So when it comes to spreading the disease, so do you think like children are more or less likely to transmit COVID-19?
See, children are as likely as adults to become infected with COVID-19 within their households, right? But because their lack of severe symptoms, and most of the time that is 60-70% cases, children are asymptomatic, even if they are positive. So it is always, they are not aware that they are infected. And this is how other contract COVID-19 from children. In settings where mask wearing and social distancing are enforced, young kids do not seem to spread virus very much when the rules and guidelines are being followed. This is very important. If precautions are not being taken, children infected with coronavirus very well could spread into adults. So what is not clear yet is how great that risk is. COVID-19 transmission from children to adults may have occurred in 2 out of 10 households, that is almost 20% with susceptible household members. And this is according to study published in Journal of Pediatrics.
So my next question is actually, what is the best way to protect children, especially if they are newborns or if they are infants, when they really cannot wear mask and they have to be taken care of by their parents?
This is very important question, I feel. These infants and newborns can be protected from COVID by avoiding large crowds and keeping a safe distance at least 6 feet. Nowadays, they say even 10 feet because it's airborne. So from other people when you go out. So as far as possible, don't take them out. But if you go out, keep safe distance and avoid large crowds. At home and in public places, do all you can help stop the spread of virus by one, avoiding people who are sick, washing hands well and often, especially when you go back into your home from being outside, before handling your child, before breastfeeding, and even before feeding the child routinely. Then cleaning surfaces and objects that people touch a lot, like doorknobs, countertops, cell phones. So there are certain areas where people touch more. As far as possible, try not to touch your eyes, nose, mouth, face when you are near your baby. So by that you can just give infection. It is advisable to sneeze or cough into tissue or elbow. These two things are mentioned, and not to your hands. So this should be avoided. Dispose of tissue immediately after use, and clean elbow or whatever you use immediately after you use. It is also advisable to wear a mask at home if you are sick, and try to limit contact with your child until your symptoms have completely stopped. And in case of newborns, if mother is not having COVID infection, she can, of course, take care of a newborn and continue exclusive breastfeeding. But in case mother is COVID-19 positive, then also she can continue exclusive breastfeeding, and she has to wear mask. Wash hands thoroughly before feeding, avoiding touching her face, eye, mouth, nose while handling the baby. And she should hand over a baby to caretaker or father, whoever is COVID negative. And the newborn is kept away from mother till she becomes negative for COVID-19. But you should continue breastfeeding during that period and just give baby to the mother. She will feed and give back to caretaker.
So, do you have any advice for large joint family settings? I know you talked a little bit about that, but in general, like, do you have any advice for grandparents, parents, and in a large setting?
Yeah. In general, children are less susceptible, as we have seen, to severe COVID-19 infection. Therefore, if mom and dad are sick, a child be with mother unless mother is too sick or hospitalized, as we have seen. In case of infants, continue to breastfeeding as far as possible and feasible. That also we have seen. In all these situations, parents should take precaution of masking, hand sanitization, and social distancing. These three things are SMS are very, very, very important, of paramount importance. In case of extended or collected family, what we call ekatra kutumba, non-infected person can take care of children because there are plenty of people at home. But it is not as advisable to send children to grandparents even then, because most of the time asymptomatic children can transmit infection to elderly person in the family unknowingly. If just one parent or grandparent is sick, it is advisable to quarantine that person and keep children away from him till he or she recovers. So taking utmost precaution to segregate and not coming together is the principle of controlling this infection.
So, what kind of effect on mental health of children have you seen?
Stress, fear, grief, isolation, and uncertainty created by this COVID-19 infection. And this COVID-19 pandemic is going on for so long. It can bring any child down. Many children and adolescents have had an especially tough time coping emotionally. Signs of stress, mental health challenges are not the same for every child or adolescent, as you are aware of that. Young children show increased irritability, fussiness, disturbed sleep pattern, change in eating habits, which may lead to constipation or loose stools. Start bedwetting after potty training. Frequent and intense tantrums, frequent hitting, biting. In short, these children express their stress in above mentioned manner, what I just told you. But older children and adolescents show signs of distress by change in mood. The loss of interest in activities previously enjoyed, like movies, painting, cooking, but they lose interest in those activities. Sometimes they don't sleep, they become irritable, or sometimes they keep on sleeping, keep on being in bed all the time. And change in eating patterns, either eating all the time or not eating at all, in no interest in eating, loss of interest in schoolwork, sometimes lack of personal hygiene, and sometimes, though rarely, think of death or suicide. But we have seen certain incidences. They also experience problem with memory, thinking, orientation, concentration. All these things are evident now. So these are problems with mental health. The whole pattern of life has changed. Now they have to stay home, less socialization, less mixing with other people, no schooling, and online studies. All these have impacted them a lot. So I feel it's very dreadful situation. We have to, as parents, as teachers, as pediatricians, all of us should pay attention to their mental well-being in time to come, I think.
What is your take on the vaccines
Yeah,
for
clinical.
kids?
Yeah. See, clinical trials of vaccines are underway in children as young as 6 months. But before COVID-19 vaccine become available for younger children, clinical trials need to be completed. And once the information regarding safety and efficacy, both is important. And unless they are available, then the vaccine will be recommended for children and adolescents. The vaccine currently, as you already said, to children and adolescents about 12 years in the US, because it is evaluated for its safety and efficacy. I think Singapore is also coming out with vaccines below 10 years. But unless we prove that, we cannot uh, give to kids. But I think shortly we'll get that.
So I just want to ask you about, I mean, of course, coronavirus can have third wave, fourth wave, and so on. And already there have been two waves. So how do you think the future waves in the worst or best scenarios could impact children?
See, experts say that we may see a few more and distant waves in the coming years. After that, virus will run out of evolutionary options and settle down as a more benign epidemic pathogen, as what we are seeing with even HIV, right? So it is difficult to predict the number of COVID-19 waves in India with available scientific evidence, of course. There is no documentary or epidemiological evidence that kid will get affected in large number in possible third wave. There is absolutely no documentary evidence. India will possibly see another wave, but since a large number of people will get vaccinated, because we are gearing up that, the wave may not be as big as current wave. That's what experts say. uh, Principal scientific advisor of India said there may not be third wave at all in this country if strong measures are taken and effective implemented at the state, district, and city level.
So those were all my questions. Thank you so much for taking up the time to answer them. Thank you so much.
Thank you, Divya.
Well, this brings me to the end of this video. Thank you for watching. If you like the video, subscribe to my YouTube channel, Quick Mommy Hacks, and follow me on Instagram.